Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
We all have stress in our daily lives, but it seems that managing high blood sugars and the complications of diseases can make life more stressful for diabetics. How does this impact a patient's mental health?
It can be quite challenging for patients, and actually managing diabetes can be quite overwhelming. Especially if patients find that their blood sugars are not at goal, they can get quite frustrated, and they can also have fear about complications and the risks of running too low and have hypoglycemia. And actually research is starting to focus more on diabetes and depression and the connection between the two. And interesting studies are coming out in the future about that.
Do you have any tips to help a diabetes patient monitor their blood sugar?
I think it's important to see that the numbers, the blood sugar readings, are for guidance for both the patient and the physician, and it helps us how to change the medications and the interventions. And sometimes I find that patients get upset when their readings are not at goal, and again they can get quite frustrated, especially when they feel that they try everything. I think it's just be hopeful can be very helpful, that one day we can find the perfect regimen or treatment for the patient, and eventually I think everyone will succeed and then find success.
How does stress affect a patient physically?
With diabetics, the special problem is that stress can increase blood sugars, and it can cause sort of like a vicious cycle when we are just sort of chasing our tail. So it definitely has a very bad and negative effect on patients.
Does exercise help mitigate the stress of diabetics?
It definitely does, and it does in multiple levels. It's important to find something that the patient enjoys in terms of exercise or activity. And then we all know that exercise can help release stress, but in diabetics it also helps decreasing blood sugar, and then it can give sort of like a sense of success and achievement.
When the numbers are too high or too low, what can someone do right away to lessen the immediate worry?
Well, we give advice what to do immediately, but it can be also helpful to write it down, sort of like write as a journal, mark a note that what happened beforehand and what may have caused it. And it's also good to keep track of the symptoms so that it happens in the future, patients know what to expect, and then they can catch the problem beforehand. And it's also nice to review, and then sort of we can find a pattern, what may have caused it, and it's easier to prevent.
Where can people look for support and help?
I find that family and friends are really important, especially if they have family members who also suffer from diabetes, because then it's easier to manage the diet and the exercise. They can do a lot of things together. Luckily, current days we have many resources such as social media groups, diabetes groups that are easy to find online. And I think it's very important for patients to connect. There are also many occasions, there are like runs or like a 5K run, and many events that are organized by multiple cities, like for example City of Worcester, sometimes here at UMass. And then I think for children, they have diabetes camps where they can meet friends who have the same problem. We offer classes, and the dates of the classes can be found on the walls in the clinic. And we try to refer patients, especially those who are newly diagnosed, and they can take part of this class and learn how to check sugars, how to inject insulin, and also they can learn about the diet, what changes they need to make in their lifestyle. If they find it difficult, we can make it a one-to-one meeting with the educator and the nutritionist. But I think in the class, they can sort of bond the patients and hopefully find friends that they can stay in touch with or call if they are in trouble.